today the responsibility what is assigned to me is to elaborate on the theme of 2016 given by International Council of Nations. As you know, Sister Leela has given a wide speech on it, and Sister Chaya has explained very elaborately on the theme. So it has reduced my responsibility to speak on the same theme. But you know, the challenges before my presentation, I just want to share you. The last year, that is 2015, has so many tremendous or many vital and many important changes in the global scenario of health. Because since our textbook times, in our nursing times, we used to hear about the Millennium Developmental Goals 2015, and 2015 has long gone. So the entire thing has changed. So, welcome, sister. That was my biggest challenge for the day, and it is a huge challenge for you also, everybody who's sitting around here, because the global health what we saw last year and what we are seeing from today onwards is totally different. So I hope the complete thing, I will try to make it in a very smooth and soft manner so that everybody can understand and grasp about it. So let me start my presentation. So today's my lecture will contain the Millennium Developmental Goals report, MDGs to SDGs, that SDGs stands for Sustainable Developmental Goal. I will explain what is it. SDG 3, which is vital, very important for the healthcare sector and nurses. UHC, role of nurse in strengthening the health system. Definition of nursing by ICN. This is the very next important thing. The ICN, but we have learned the definition of nursing since our first year, right? Fundamentals of nursing by Anderson's definition. The ICN has changed it. We cannot say it is changed it. ICN has promoted or some other definition. So I will be explaining that also. Developing the strong health system resilience, and improving organizational resilience. So that is a huge task which is given to me today. So starting from the Florence Nightingale quotation, the very first requirement in a hospital is that it should do seek no harm. So Millennium Developmental Goals. So Millennium Developmental Goals, the history says in the year 2000, the global leaders came across from all around the world and made a conference to make sure that the people of the world shouldn't have any poverty. Like we all came here after having, enough breakfast. You had tea now. You know how many of the millions people can't have butter and bread for day? In 2000, there were 200 millions of people were there. So that was the biggest challenge, the poverty all around the globe. So they came across and they put some targets for it. So that is Millennium Developmental Goals, and we strived for achieving those targets in the coming 15 years. So from 2000 to 2015. So now, in 2015 has gone. The last month, in the month of September, they came across with a report. In the report, they said, it is revealed that many of the targets were achieved. The poverty has come down from 200 million to 800 million. There are still 800 million people who cannot eat once a single day. Mainly from 5 countries. Of course, there are still poverties in India. It's a big task and big sad fact. So they came across and they understood that the targets what they were achieving need to be sustained. So they put next level of targets. That those targets were called SDGs. It is known as Sustainable Developmental Goals. So these Sustainable Developmental Goals contains 17 points, and out of these 17 points, the point number 3 is important for us, that is SDG 3. And SDG 3 says, ensure healthy lives, promote well-being for all at all ages. We have a problem, as Sister Chaya explained. The people are getting old, and because of today's medical care and nursing care, the age is increasing and the health problems are also increasing. So there's a tough time for it. So we need to handle it. So out of the 13 health targets in SDG 3, I mean the SDG 3, that is ensure healthy lives and promote well-being for all the ages, have found 13 health targets. These 13 health target includes reduction of global maternal mortality rate due to 70 per 1 lakh live birth, newborn and children under 5 years of age, their mortality should come down. Epidemics of AIDS, tuberculosis and malaria need to be decreased. The burden of non-communicable disease and importance to the mental health need to be taken care of. There is an important notification in this one, that is a road traffic accident need to be taken care and it should be reduced. Sexual and reproductive health care need to be addressed. Universal health coverage. Still, do you know there are millions of people, once when they are having any health trouble, they cannot go to a doctor because doctors are not available. Nurses are not available. There are millions of people who are dying because they do not have the access to the health care. It is one of the important things. And if at all they have the access, it is very costly. If they go to a doctor, they pay for it, they become the bankrupt. They need to sleep on the roads for next time. So all these problems are there. Next thing, pollution and contamination. The odd even formula, which is a very, media attention-seeking one in the Delhi. You all know about it. The global changes. So this is also taken into consideration. There are 4 enablers. One is tobacco control. Nowadays, every film shows the tobacco advertisements first, right? Because of that, there is a massive reduction in smoking habits. Even Rajinikanth stopped smoking in his films right now. So all these things have given a huge, tremendous public awareness about the ill effects of the smoking, and so that it has come down. Research and development of vaccines. Once a vaccine is developed, the patent is taken by the US people or any abroad, living people. Once when the patent is taken, the royalty should be given for it. And the royalty should be given not in Indian rupees. It has to be given in US dollars. And Indian rupee and US dollar have a 70 rupees difference. So it makes a huge challenge. So international community has identified this, and once when any vaccines are found out, the spreading of it should not be affected because of this royalty. This is a thing what they have noticed. And health financing and the recruitment. As you all know, recruitment is a very important thing. If the expenditure is not put on the health services, poverty results and the entire country collapse because of it. So it's a huge and important thing. World Bank has emphasized it for last 5 to 6 years continuously, and still nobody has looked into it. Management of national and global health risks as just simply like the Ebola what we have. No, countries' boundaries will stop a disease like Ebola. Once it starts from America or from Pakistan, it will come to India and kills millions of people, and we are very grateful to the God that Ebola didn't came to us last year. The emphasis on universal health coverage. You can see the definition of UHC as I explained to you before, even in India, especially in the states like the... And why should nurses engage in health system strengthening? That's of course a question for it. This man is saying something, and why we should be important in making this strengthening. The main thing is any inequality in the social sector is being first seen by you people only, we people only. We so, once when the doctors take the bribe, once when the extra money is paid to the commission agent, once when the nurse is taking the bribe, once when the corruption is there, everything is first so by we nurses only. The country progress. And the next thing is the role of a nurse as an advocate. It is written since our first year textbooks. And next is supporting the health and social needs of the vulnerable population. And if you don't, nobody does. This is the most important slide what I have, and especially for the kids from the College of Nursing. The Henderson's definition of the nursing is the unique function of the nurse that is to assist the individual in performance of those activities contributing to health or illness, so and so has gone. Now there is a more comprehensive definition of nursing, which is a 3-sentence definition, which I request you all to read thoroughly and understand. I will read it. I know the time will go in this, but this is very important because this is the essence of nursing. Nursing encompasses autonomous and collaborative care of individuals of all ages, families and groups, and communities, sick or well, in all the settings, even in space. Nursing includes the promotion of health, prevention of illness, care of ill, disabled and dying people, advocacy, promotion of safe environment, research, participation in shaping of health policy, and in patient and health system management was really very less. Next is resilient systems are self-regulating, autonomy. Brothers and sisters came together. That kind of teamwork makes the resilience very effective. And once you, so these are the questions related to the risk assessment. So how very simple little can be done under the spirit of fire. Every crisis comes with the associated fear. So how you respond to the crisis with the fear matters a lot. Once when the fire comes, once when the earthquake comes. I remember last year once I was presenting in saying this podium, all the thing was, it was just trembling. So any condition with fear, and you need to manage other people also. It is very important because you are nurses. So that's all about my presentation about the theme. My colleague Helimani will continue the theme with this. I would like to take on any questions if you have anything on this topic. Any questions? Or any suggestion or any command will be welcome from anybody. Any add points? Anything, sister?
Thank you, Dhikhil. Very beautifully you have presented your paper. आप लोगों को रेजिलेंस का मतलब तो समझ में आ ही गया होगा। रेजिलेंस का मतलब होता है कि अपने को तैयार करना वो भी आपत्तिकालीन स्थिति में। जैसा कि डिखिल बता रहा है कि पिछले साल वो हम लोग यहीं पढ़ते 12 मई का समय था, एकदम से अर्थक्वेक आया। हम लोगों ने क्या किया, हमें लगा ये हिल रहा है, भागने की कोशिश की। अगर ये चीज़ बिल्डिंग के अंदर होता या मान लीजिए कभी आग लग गई, कोई ऐसा पेशेंट आया जो बहुत से कि ऑक्सीजन खत्म हो गई, तो जो अपनी तैयारी होती है प्रिपेयर्डनेस फॉर इमरजेंसी,